Right, so if you have read and understood, considering it's surgical anesthesia, kindly tell me, what are you looking at?
This is a gross specimen of stomach
Yes?
and surrounding structures.
Okay. Can you please tell me the parts of the stomach?
Yes, ma'am. The stomach has cardia, fundus, body, and the pylorus.
All right. Can you please identify structure 6? Here.
It's fundus of the stomach.
Okay. Can you please identify number 2?
It's a body of the stomach.
Okay. Can you please identify 18 over here?
It's atrium of pylorus.
Yes. Can you identify 19?
It's a pyloric canal.
Yes. 23, please.
It's first part of duodenum.
Right. Can you please tell me the blood supply of the stomach?
Yes, ma'am. The greater curvature receives blood supply from right and left gastroepiploic artery and short gastric arteries, and the lesser curvature receives its blood supply from right and left gastric artery. The left gastric artery is the direct branch of celiac trunk. Right gastric artery is branch of hepatic artery. The right gastroepiploic artery is a branch of gastroduodenal artery, and the left gastroepiploic and the short gastric arteries are branches of splenic arteries.
Okay. Can you please tell me the venous drainage as well?
Yes, ma'am. The left and right gastric veins, they drain into portal vein. The right gastroepiploic vein, it drains directly into superior mesenteric vein, and the left gastroepiploic and short gastric veins, they drain into splenic veins.
Can you tell me what are the structures which are related or in contact with the bed of the stomach?
Yes, ma'am. The structures are diaphragm,
Yes.
lower end of the spleen, left lobe of liver,
Yes.
then left side kidney and left suprarenal gland, and
Yes.
Also splenic artery, pancreas, body of the pancreas, and also there is transverse colon and splenic flexure of colon, which is separated from posterior part of stomach and lesser sac.
All right. Can you please tell me what is the most common, what are the types of tumors that occur or you know of stomach?
Adenocarcinoma.
Of the, yes.
Adenocarcinomas, then there is lymphoma,
Yes.
GIST tumors,
Yes.
and also some benign tumors are there.
Okay. What is the most common type of carcinoma of stomach?
It's adenocarcinoma.
Okay. How would you confirm your diagnosis?
I would like to do first barium swallow and barium vein studies, followed by ultrasound and CEC contrast enhanced CT scan, followed by endoscopy and biopsy.
Okay. How the carcinoma of stomach can be classified?
There are multiple ways of classification, the TNM classification, and the other is depending on morphology, the Borman's classification.
Yes.
And Japanese classification, in which there are 4 types.
Yes.
First is polypoidal, second is ulcerative, third is necrotic, and fourth is lineatus plastica, which involves whole of the stomach.
Okay. Can you tell me the attachment of this? It's on the greater curvature. It's the omentum which is attached from here to where?
Yes, ma'am. The omentum is attached to the stomach. It has 4 layers. The anterior 2 layers and posterior 2 layers. It's an apron-like mass along the whole of the greater curvature of the stomach and first part of the duodenum. In its upper part, it's condensed, forming gastrosplenic and the ligament which connects stomach to the diaphragm.
Okay. I was going to ask you, okay, I forgot the question altogether. Okay. I'm sorry, I forgot the question. What is the lining of the stomach? I have forgotten the question. Can you please tell me what are you looking at in this diagram?
It's a diagram showing barium mill study.
Okay.
And
would you be able to identify the structure 1 to 6, please?
Yes, ma'am. 1 is the body of the stomach. 3 is lesser curvature. 2 is greater curvature. 4 is pyloric antrum. 5 is pyloric canal. And 6 is first part of duodenum.
Okay. What this image is trying to show, or would you be able to interpret it?
Yes, ma'am. It's showing some obstruction. The dye is not going into the first part of duodenum. So there might be some constriction at the pylorus.
Yes.
And the rest of the stomach and stomach bubble appears normal.
Okay. What are the surgical alternatives or options that can be offered to a patient which has carcinoma, stomach, adenocarcinoma of the stomach?
Yes, ma'am. If in cases of proximal cancers, we can do total gastrectomy with esophagoduodenotomy or
Proximal, you mean involving cardiac and fundus, or how do you mean?
Yes, ma'am. This involving the fundus and the cardia.
Yeah.
And in cases of distal, that is the body and the pyloric malignancies, we can do subtotal partial gastrectomy and Roux-en-Y anastomosis.
Okay, I remember the question now. What are the risk factors that can be avoided which lead to the formation of gastric carcinoma?
There can be eating certain smoked, excessive amounts of smoked food.
And
it's considered to be, and also smoking and
male gender. Anything else? Anything to do with the race or?
Sorry, ma'am.
Okay. Risk factors you can learn. Rest we knew.
Yes, ma'am.
Right. Thank you.
Thank you, ma'am.